This is the Lyndsay Stafford Show.
All right, welcome back to the Lyndsay Stafford Show. We have a really special guest today. All of my guests are special, but this is such an exciting episode. We have Bone and Joint's very own Dr. Dee Dockery, who is coming to Bone and Joint Spring Hill with some incredible talent. And we are so excited to showcase some of the things that he's going to be bringing to us. Dr. Dockery, thank you for being here with me today.
Thank you for having me.
Yeah, we're excited. So tell us a little bit about you and your background.
I was raised in Memphis and went to Tennessee for undergrad and Emory for med school, and I've been in practice for 20 years in Memphis. I treat back and neck pain with minimally invasive procedures and conservative care. I basically, when you come in to see somebody with back pain, a lot of times you'll end up in our clinic, right? Back or neck pain, acute or chronic, right? So if you have pain that you've been hurt, it's just for the last week or two, or something's been hurt for 2 years, or something's been hurt for 20 years, a lot of times we have things that can really make you feel better. Often for the people who feel like they've been struggling for a while and they feel like they've kind of lost hope, or maybe they've even failed surgery, or maybe failed multiple surgeries. There's things that we can do for them that can help their pain as well as their quality of life and their function.
Well, it's such a needed support service. There's back pain, back and neck pain can be just excruciating. And I know firsthand, I had a very good friend who experienced exactly what you're talking about. And it was years and years of, I wish we had Bone and Joint. This was in Maine. Unfortunately, Bone and Joint wasn't there, but it can be life altering.
Sure.
Tremendously. What led you to Bone and Joint Institute?
So, been in practice in Memphis for 20 years, and I was raised there, but my mother's here in Memphis. I mean, my mother's in Nashville. My brother's in Brentwood. His two adult sons are in Brentwood, and my wife's sister, who's her best friend's in Columbia. And so we have one more child who will be at home, but the other two will be moving on as of this next week. And so we were ready for kind of make a move somewhere outside of the city. And my wife fell in love with Columbia a couple years ago when she came to visit for a wedding shower. And she came back, she's like, I know where I want to go. And I said, well, I've never been to Columbia, but I'm excited to go look. And so at that point, started looking into options to pick up. I've been in practice for 20 years in one place.
Yeah. It's
a big move. And so Dr. Scott Arthur at Bone and Joint's a friend of mine, and reached out to him, and I was just blown away by the kind of quality people they have there. Just great hearts, people you'd love to just watch a game with, go to dinner with. I mean, just good guys. And the staff's and administration's amazing as well. And so I felt like that I had a good fit there as well. So I'll be practicing the Spring Hill office, right? So they have the headquarters in Franklin, they have Brentwood as well, and they have a kind of a newer clinic down in Spring Hill. And we will be living in Columbia. It's just 15 minutes up the road, and they don't have they have a walk-in clinic, and they have some specialists come down for a clinic or two a week. But I'll be the first guy who's got all my clinics there.
Wow.
The number one reason people come into walk-in clinics in the orthopedic world is back and neck pain, right? And so it made sense to put a spine specialist there to have an easy transition for people when they come into the walk-in, have somebody that can see in that area. And they're also building out a block room. So I do interventional procedures. So when people have back and leg pain, epidurals or chronic back pain, facet injections or SI joint injections. So there's I'll be doing a lot of all of my procedures that are done in the block room in Spring Hill. So I'll be in clinic a couple days a week. I'll be doing the block room a couple days a week. So it'll be easy for people in the Spring Hill area as well as south of that in the area. Instead of having to go up to Franklin, they'll be right around the corner to do their block as well as see them in clinic.
Wow, that's incredible. They're so fortunate to have you, and you're so fortunate to have them. It's like a perfect, because you're right. I'm number one fan of Bone and Joint. The team there, you feel it when you walk in. I mean, you can't help but see the integrity and the level of care that they give. I've been on both sides as patient, as the parent of a patient, and now I get to be on the other side and really learn the ins and outs of Bone and Joint, and it's incredible. What stood out to you about the team at Bone and Joint and the way they approach patient care?
Well, I think that all of the doctors are very technically very gifted. So you're getting top-notch care, people who've been really well trained. But I think the most important thing is having that separates them is having the kind of patient kind of connection, right? They really I feel like the guys there that I've met and I've seen, they really make sure that they're connected to the patients. They're invested in their outcomes. They're not just walking in, throwing an MRI up on the screen and saying, this is what I can do, yes or no, moving on, right? They really want to kind of get the history, get to know the background, and you want to have a rapport with the patients. You want patients really to know that they can trust you, that you have their best interest at heart. And I feel like that's what stands out about the Bone and Joint team. Yeah,
you mentioned just getting to know the patient. And I think that is something that is so unique about Bone and Joint. Like I said, I've experienced it on the other side, but the patience of the doctor to sit down at every interaction I've had and not feel rushed and really be focused on the person in front of them and think instead of thinking about the next person they're going to see. That stands out to me in all of my experiences at Bone and Joint. So it's incredible. So let's talk a little bit about the being somebody in need of your services. So for someone searching pain management doctor near me or non-surgical orthopedic care, what should they look for in a provider?
Well, I think it's important that you find somebody who's has some experience, that somebody that has ability to kind of have different things in their arsenal to treat you, right? So you want to have, there's all sorts of different types of procedures. And for each patient, it's different for every patient. Every patient's different, but what I love about what I do is it's a puzzle, right? The neurological, musculoskeletal part of this, you're putting the puzzle together. You got to figure out what's the missing piece. What's going on here? What's missing that you can fill in to make these people feel better? And there's all sorts of injections. So there's interlaminar epidurals, there's transforaminal epidurals, there's caudal epidurals, and then you have all these injections at different locations, right? And then you have injections where you block the facet joints, you block the SI joints, you can burn the nerves. So you got to make sure that you have a thorough history, and physical is critical, right? I mean, there's all sorts of different pain generators. You want to find somebody who's really going to invest in getting a good background, a good history, and do a thorough exam, because there's all sorts of red herrings on imaging, right? If you're just looking at an MRI, for example, I've got arthritis in my back right now. I'm not hurting, right? So I know I got a couple of disc issues, I'm not hurting. So it's up to the provider to figure out, hey, you got a couple of things going on here. It's on the history exam and the imaging, you put it all together to figure out where the pain's coming from, right? So you usually make sure that somebody has some experience who's invested in putting the time in to get the background, the history, and rather than just walking in, throwing up an x-ray and be like, oh, yeah, those are your problem, and not even put your hands. You'd be amazed at me, people who I've seen in my clinic who come in and I do an exam and they go, thank you. I'm like, what? Like, you actually put your hands on me, you did a physical exam. And like I've seen like two guys and they didn't even touch me, right? And so,
wow.
And so it's just this, you're taught in med school and residency a way to handle these things professionally for a reason, right? Because that's important. And sometimes, like you said, people feel rushed, and and they maybe hear a couple sentences and think they know the answer and they move on. So,
moving too quickly. This is a common theme with folks that sit in this podcast studio. We talked about this before we started recording, about the integrity of the level of the folks that I am privileged to interview. And moving too fast is such a commonality in the world that you have to, when you're looking for someone, especially that's going to perform something on your physical body, your back or your neck, you need someone that's willing to slow down and do it right and take the time.
I agree.
And it's not about how fast can I move, it's how right can I do it.
Right.
Love that. So speaking of specialties and you're bringing a couple of different services that are not in Middle Tennessee yet to Spring Hill. Can you talk about those?
Yeah, so one of them is called Intercept. It's also called basivertebral nerve ablation. So there's there is a whole subset of patients who've had chronic pain 10, 15, 20 years, sometimes 30 years or even longer. And these people have a good bit of degenerative changes in their back. And they're often people with just primary back pain. And epidurals may help a little bit temporarily, 50% for a few months or so. The facet injection, the side joint injection don't help at all. And what it is that you have, you think of like a disc as like a tire, okay, on your car. But unfortunately for this model of car, there's no spare tire, nor there is a pump to pump the tire back up. And so what happens is when these tires go flat, when these discs break down, over time they collapse. The bones around them, so you have the disc, right, and then the bones above and below it, and that disc collapses. The bones that it's supposed to give the cushion to has no support, right? And the response is your body will develop what's called end plate changes, and those are basically reactive edema, swelling in the bone around the disc. And that swelling in the bone can cause a ton of pain. And so forever, these people will have swelling in 3-4 bones up and down their spine. They have tons of pain.
Wow.
And the spine surgeons don't want to fuse it generally because it's just back pain, right? So every level you fuse for just back pain, the chances of success become less. Fusion's a lot better. If they have a lot of leg pain, great candidate. But if it's just back pain, and so the injections only help so much. And so this procedure is come out where you basically take a bone access key, like a thick needle, you go down into the bone, and there's a nerve that sits right in the middle of that bone called the basivertebral nerve. And that nerve absorbs the pain signal from all the swelling above it, from the disc above and then below, the disc below, around those discs. And you can actually take that needle down in there and a ablation probe, and you could burn that nerve. If you burn that nerve, this is a key, this is the most important part of this. Almost all nerves, just like this wire, have an outer coating called myelin. They have wires on the inside called axons, okay? So almost every other nerve generally has the outer coating on it, right? So if you cut it, it can kind of grow back over time. This nerve does not have the outer coating. So once you burn it, it's burned for life. It doesn't come back. So you can have these people be in pain for 20, 30 years.
Wow. You
do this procedure, and they will call back a week or two later, and they're like, you understand, my pain's like 90% gone. It's gone. And if it's gone for life, right? Unless they do something different, like rupture a disc or break a bone. But that pain they've been dealing with for decades. I mean, I've had the first lady I did was a mother, a friend of mine, and she'd been seeing me for a decade plus. I do injection on her to help her out for a few months at a time, 3 or 4 months, 5 months, and help her like 50% maybe, something like that. And we did this procedure, and she called back like a few days later, and she was like, I'm pain free. And I just saw him in mass at church. And I was like, hey, how's your mom? It was like a year ago that I started these procedures, and I've done like 60 plus of them. And
wow.
He's like, she had her 50-year college reunion, and she danced to everybody under the table. She's like, no pain still a year later. And she'd been hurt for like 30 years, right? It's an amazing procedure. So,
that's incredible.
Yeah.
Okay. So there's another one that you do as well, right?
Yeah, there's another one. And people all do these as well. I feel like this area could probably have a little bit of representation. It's called a kyphoplasty. And so when women and men, but women, especially everybody's heard like things about osteoporosis as postmenopausal women. That's the most common type of osteoporosis. Then after about 75, men and women are just as likely to have osteoporosis. It's called senile osteoporosis. So the most common type of fracture people have when they have osteoporosis are compression fractures. That's where the spine collapses, right? And they can cause devastating pain. And these fractures, unlike if you break your finger, 6 weeks later you have a callus, the bones have rejoined and you're off and running. These fractures can cause pain for many months or years and often never heal, okay? Wow. And so the problem with these fractures is that they cause so much pain. People struggle just getting in and out of the bed, doing any activity. There's a high increased risk of mortality. People die with these fractures, not from the fractures, but because of the complications. They get blood clots, they get urinary tract infections, they get pneumonias, they have complications. And because these fractures just will linger 3 months, 4 months, 5 months, and they're just not moving. So there's a procedure called a kyphoplasty. It's the same surgical access as the intercept.
Okay.
So that's how intercept is very easily picked up. I mean, because I've been doing this kyphoplasty for 15 years,
Wow.
right? It's the same surgical access, but once I'm in the bone, I'm not going there across and burn the nerve. I drop a balloon in there, and that balloon, remember those bones are collapsed. You kind of help restore that bone height. You take the balloon out, because you create a little cavity, you take cement, and you put cement in there, and it fills in that little cavity, will spread through the bone. It's like putting a cast inside that fracture.
Wow.
And these people, as soon as you roll, because that cement sets right away, and as soon as you see them in post-op, they'll like be rolling over, and the gurney be like, I'm not hurting. Like they won't believe it, right? They're like, oh my gosh, because the bone's not moving anymore. So you stabilize the fracture, and that procedure gets them up moving around, and it decreases the risk of the complications as well, because they're up moving back to their quality of life. And of course, it can feel amazing really quick. I mean, studies show about 85% of people feel much better within 2 weeks, right? So, but it's a credible procedure. I think there's a lot of people out there, some of the old school thinking with these patients that put them in a brace and you rest them, and these people I've had people who've been hurting for 2-3 years. You get an MRI and that fracture still is not healed 2-3 years later, right? And they've been told forever there's nothing to do for them. And they finally come in, we do it, and they're like, oh my gosh, why did somebody not give this before, right? I just suffered for so long. So
wow, that's incredible.
Yeah.
So both of these services you're bringing here to Spring Hill with Bone and Joint.
Correct. Yes.
With experience, you said you've already done 60 of that.
60
of the other one?
Yeah, 60 of the
Wow.
intercepts in the last year. I've done thousands of the kyphoplasty over 15 years. So
wow, that's incredible. What a great resource we have here. We're so fortunate. So how does, as a physiatrist, am I saying that right?
Yes.
Okay. Yes, I practiced. How does a physiatrist play a different role compared to a traditional orthopedic surgeon?
So general orthopedics, right, just like anything else, goes anywhere from foot to shoulder and neck, right? So a general orthopedics kind of hip and knee replacements and maybe a little shoulder here or something like that. The way medicine, especially orthopedics, has kind of evolved is there's so much subspecialist care, right? Just like I taught those two procedures, like the intercepts and kyphoplasties, those are things that you are spine specific, right? So physiatry in general is, the general physiatry can go anywhere from like the inpatient stuff, taking care of like head injuries and strokes and spinal cord injuries. The outpatient stuff is kind of non-operative sports medicine stuff. So some of the guys who do physiatry outpatient are not interventionalists. They see, sprained ankles and, rotator cuff injuries, stuff like that. And they do often now, there's ultrasound guided injections. So a lot of them kind of do the ultrasound guided injections in the office. Mm-hmm. And then the interventional guys like myself are doing a lot of the spine specific stuff. So you're just focused on back and neck pain. You probably see a little bit of other stuff as well, but there's so much back and neck pain out there. The number one reason to go into a walk-in clinic is back. It's tough to kind of blend elsewhere, but you're coming to see us to try to theoretically avoid trying to do something under the knife, right?
Sure.
So that's my goal is, sometimes you got neurological sequela and emergencies and it just requires that, right? And that's what's needed. But the goal is trying to avoid going under the knife for spine, like, doing a fusion or something like that if you can, right? That's the whole goal. And then, because once you go under the knife, there's statistically, once you have spine surgery, if pain comes back after surgery, chance of it ever getting better becomes less. Right. So it's a prognostic thing as well. You don't want to go under the knife unless you need to in the right circumstances. And I do think our spine surgeons I met, they're all great guys and they're all very talented. So I know that they, when they make that call, they're doing the right thing.
Right. But there's so much that can be done before that.
That's the idea. Yeah.
As the alternative. Yeah.
Right.
And what a blessing that Bone and Joint offers. We've got it all. It's like you come to that one place. And I can't believe when I look at the talent that's there in that facility. I mean, as a whole, Bone and Joint, like the list and credentials of the physician, it's amazing. What makes Bone and Joint Institute of Tennessee a trusted choice for patients looking for conservative non-surgical solutions?
Well, I think the fact that they've made sure that they've hired. So I'll be the third physiatrist there. There's two other guys who do the interventional stuff there. I think that says a lot, because as well, they have, the nurse practitioners and PAs and stuff like that as well. So you have a full collection of talent of people from, of physicians as well as the physician extenders who are willing to make sure that they bring people through the path. When you come in I always tell people, if you walk in to somebody's office and it doesn't make what orthopedic specialty matter, if they walk in and they don't put their hands on you, and they don't do an exam, don't do a history, and the first thing they tell you is we're going to have to do surgery, you may want to get a second opinion, right? Because that's a big decision, right? Just like Intercept, it's a big decision. So it's not something for somebody who's just had pain for 3 months. These are people who have kind of tried all conservative treatment options and gone down that path and make sure they had a surgical evaluation, make sure it's not a surgical case as well. So same thing. I think that you're going to get, when you come to bone and joint, you have that kind of full blend of caretakers who will take you from point A to point Z, not with going through B, C, D, not just A to Z, skip everything else.
Right. Again, it comes back to the commitment to doing what's right for the patient, regardless of how long it takes.
Yes.
You're going to do the right thing. Now, one of the benefits of physiatry is avoiding surgery, which we talked about whenever possible. And you talked about some of the non-surgical treatments. Are there any other common non-surgical treatments that you'd want to mention?
Well, so, 90% of what I do will be the blocks, right? So when somebody comes in with pain in their neck, shoulder, down their arm, they have a arthritic disc or hernia disc, irritating a nerve root, right? That's where you can take a needle and put a little medicine around the disc, around the nerves. It's same risk as the epidurals the women get when they have a baby, but safer because we're using an X-ray, right? With I'm not sure if you had an epidural, but they kind of just bend you over and kind of guess, right? This, you're on your stomach. We have an X-ray and we're using anatomy, so it's very precise. We're dropping the needle in, we're putting contrast. So it's and that itself can make those things can last for years, right? So once again, and then you have people with arthritic joints as well in the back and the hip that you can inject instead of fusing. A lot of times these injections can help for many years at a time. And those are super low risk. It's just like getting a shoulder injection in the back, right? When you're injecting those joints, it's just more to it. The joints are little, and you have to have X-ray to lined up to see where you're going. So those are, so anybody with back and neck pain, I'm always happy to take a look at. I get calls from friends all the time and family members, and just like doctors. My wife's like, "Do you ever not work?" I'm like, "There's something called text messaging and a phone call and cell phone, and it's all everybody's always reaching out about stuff." So
that's awesome. My mom actually experienced that with bone and joint. She had a block done. Somebody else told her she needed surgery. She had a block done, and it was to the point where she couldn't even sit. I mean, it was the kind of pain that is just hard to watch someone in. And she's not that old, so it's it was very concerning.
Right.
But we're golfing together this afternoon.
Fantastic.
So she's doing amazing. But it's funny, I have an uncle who's a pediatrician in Ohio, and his son is actually a geriatric doctor, my cousin. And my uncle has been my go-to, of course, for everything raising my kids. I'm like, let's text Uncle Rick. Let's call Uncle Rick and see what he says. Right. Yeah, I had to tell my son, we were in Ohio and he wasn't feeling well. We were visiting my grandmother. My son wasn't feeling well, and he stayed at the house we were renting, and we took the other kids out, my daughter and her boyfriend. And Ben said, "Mom, I feel the worst I felt." He's texting me, and I said, "Well, I want you to text Uncle Rick and tell him." He said, I don't really feel comfortable. I said, "Ben, this has been the guy who's helped me your entire life."
Your whole life.
And he's just a teenager. Yeah. So, and he did eventually end up, I was like, he loves you, has helped me since literally the day I brought you home. Okay. Right. So you do become everyone's doctor when you're a doctor.
That's part of it.
Oh, I love it.
It's kind of the Doc Holliday, if you remember the movie. They just say, "Hey, Doc, come over here."
It's so true. So how do you help patients? Oh, actually, I want to ask this first. What are some early warning signs that pain might be something more serious that people might miss?
So those are called red flags, right? So anything with red flags, you always worry about other things like infection, cancer, some sort of neurological compromise of the spinal cord, right? So the red flags in the spine world, number one, weakness, like a sudden weakness in your arm, your leg, problems controlling your bowel and your bladder, big one. some sort of issue with balance, right? All of a sudden, like I feel like I can't control my legs, or I can't stand and walk more than a minute or two, and my legs just feel like they're going to give out on me. And always, anytime somebody has the other kind of stuff, like a weight loss, right? Like somebody's lost a lot of weight, I was concerned about metastatic disease, like some sort of cancer in the spine, fevers, chills. You can get osteomyelitis, you can get abscess in the spine. Those could be deadly. So those are kind of the main ones that you got to look out for. So those red flags, generally the ones that warrant an MRI pretty quickly, right?
And so how does someone go about, let's say they're like, well, I think I might need to have this looked at. What's the process?
So the good thing about bone and joint is you have a walk-in clinic, right? So I know that some clinics you may call and say, hey, we're 3 weeks out, right? Well, and sometimes that happens with specialists. But the walk-in clinic is run by trained, PAs and stuff like that. So they've been trained by the physicians. They work with physicians. They've gone through PA school, as well as often work with the orthopedic guys for a while before they're kind of on their own in clinic. And so if you feel like there's something urgent and you feel like, hey, I don't want to go to the ER, but it's for then you can come to the PA, the walk-in clinic, and they can kind of make sure to get a good clinical evaluation and decide if they need to do something urgently. Now, if you have like a major femur fracture and you got a bone sticking out, don't walk into the walk-in clinic. You need to go to the hospital. That's a straight up emergency surgery. But for something, if you feel like something's going on, feel like it's pretty urgent, you always can go into the walk-in clinic. And I've always had an open dialogue with my PAs and my nurse practitioners. If you have something comes in and it's a fracture or something that really needs, you can overbook in my clinic. I'm happy to take care of them.
I love that. We've had such good experience. Anytime I have athletes. So of course we've been to Bone and Joint, which I will say this, I am always trying to make sure people hear how much Bone and Joint of Tennessee does for the school system in Williamson County. They provide athletic, well, you already know this, but for our viewers and listeners, they provide athletic support to all of Williamson County high schools. I mean, it's incredible what they do. It's just the culture of Bone and Joint is amazing, but we've never had a problem getting in.
Yeah.
They've always been able to make a spot for us. And that was, before I had the relationship I have, that was just, as a patient calling. So
I've been a team physician for 20 years. And so my son graduates, he plays football, can play football in college. And so I've been doing Friday nights for 20 years straight and on the sidelines for high school football. My wife, I told her once our son graduates, I will retire from that. She's like, I actually get Friday nights with you in the fall, because she's like, I love college football as well. So Saturday's kind of my day to watch college football. And so Friday night's been high school football, Saturday's college. She's like, I'm so excited to actually have dates with my husband again on Friday nights in the fall, because I've been covering the side. Now, the last few years when he's been playing, it's been fun because she's got her son out there as well. But the 17 years before that, she's like, all right, see you later.
Yeah. On Friday nights, so going to be out there.
Yeah.
But it's tremendous, the support they provide. I have my daughter's boyfriend's a lacrosse player, and she's a cheerleader. So we've watched from the sideline, and I have a basketball player. So we've watched from the sidelines the support that these guys give. And it's truly incredible. Also, I just want to highlight, your son is actually playing D1 football next year. Yeah. So that's a huge accomplishment.
Yeah. He's got a scholarship to play at Northwestern State, which is a D1 AA, or they call it the FCS, now they say FBS, FCS. So we actually went down there for physicals last weekend, and he's excited to get down there. He's ready to play.
I bet. What an accomplishment. I know you're so proud.
You're proud.
So I want to talk a little bit about Bone and Joint and how they approach patient care when it comes to collaboration between specialists. Can you talk a little bit about that?
Well, I think it's important, if I ever have a question, first of all, everybody has each other's number, right? And so being a good partner is always make sure that you're available, right? I think it's the most important thing that, hey, I got somebody I need to get in, as a friend or a family member, throw them in, no questions asked, right? That's number one. And number two, that you have to have that open dialogue, right? So if you say, I got this patient and they're not responding, and I'm not sure if this is a surgical case or not, will you please just check this out, right? And so, and vice versa, right? They feel like, hey, I got this thing and I'm not sure if I want to go down the surgical path with it. I feel like they've tried X, Y, and Z. Can you take a look at them to see if there's anything else they're missing, right? from the injection side point. So I think it's they have that. We're all specialists, but we have different tools, right? And so I don't know all the exact tools and why they use their tools with spine surgery, and then same vice versa. They don't do the blocks and some of the other stuff we do, so they may not think of a certain injection or a certain block that may be appropriate for a patient.
Yeah. So the communication is just, you see that culture of bone and joint in the communication between physicians and their specialists too, which is part of what makes it work. When does a patient see a physiatrist versus a surgeon?
Well, a lot of times new back pain issues often clinics are set up to where you want to have a interventional guy see somebody as an initial evaluation, and then if they feel like it's a surgical case, they move them to the spine surgeon. But you're going to see the way clinics will run. You have open slots; they're going to put people in. So there's not like there is a traditional kind of theoretical pathway, but often it just goes.
Yeah,
whoever's got a spot open will see somebody, right?
Perfect. Can you share a little bit about some simple proactive things that people can do to protect their joints, their spine, and overall mobility? Yeah,
that's a great question. So lower back issues especially, very important to keep your core strength, right, and flexibility. Once you have an issue in your back, like a disc or something like that, the chance of it coming back next 3 years, like 85%, right?
Wow.
So the most important thing you could do is really learn a core strengthening stretching program. Keep your core tight, hamstrings loose, strengthen your glutes, stretch out your hip abductors. That's just so important. It's the best way to protect you from having recurrent disc issues or pain. And a lot of times you can just go, a lot of times it just takes a one-time visit to physical therapy, right? They can get you to kind of, because therapists are great at looking at your background and kind of see the notes and look at your imaging and kind of understand what's going on. And then they'll kind of give you something you can do at home. And it doesn't take long. If you get like a yoga mat, and the most important thing about anything working out, I think in my opinion, is making it a routine, right? It's so many people are like, I'm going to hit the gym and get back to the gym. And they're just real erratic about it. And then they're off again. They don't go back. So if you're like, hey, listen, I'm going to do Monday, Tuesday, Thursday, Friday, when I'm watching the news and have my coffee, I'm going to do 5 minutes of core, right? If you just, doesn't take much, 5-10 minutes, 3-4 days a week can make a huge difference in protecting your back.
Yeah. The habit stacking. Stack it with something you already do. Yes. Feeling really good about my dedicated planks that I do every week. Yes.
Habit stacking is a term my wife loves to use. So.
Oh, I'm going to like her. Hey, when you're trying to increase or add something into your life, it's the easiest way to do it. Right. What am I already doing that I can attach it to?
That's right.
I need easy tricks. So that's why I love habit stacking. Okay. I want to talk just about you for a couple minutes before I let you go.
Sure.
What do you enjoy most about helping patients regain function and reduce pain?
I love when I'm able to walk into the room in my clinic after they've been treated and they just have a smile that you can't put a price on. And a lot of times especially the women, the older women just want to give you a big hug and just, it's just, when I first went to med school, I thought about getting into the pharmaceutical, surgical, stock analysis world. So when I first went to med school, I was thinking about going to get my MD and then get my MBA and then work for some big outfit in New York for surgical, stock analysis. And because I love numbers as well. I love science, but I love numbers. And the first few years are your book years, right? You're doing like your textbooks and your tests and you're going to class. And then the next 2 years, you're doing the clinicals. In that first clinical rotation, when I got the physician-patient, kind of rapport and kind of relationship experience, I was sold. And so at that point, I was like, well, forget the other stuff. So you just can't put a price on that kind of, my language of love is doing things for other people, and so it was just so fulfilling to have that kind of response from people who just generally just are so happy that you've changed their quality of life.
Mm-hmm. It's not shocking. And I'm going to look at my producer for a second, right, Jim, that when we ask people that come into this studio, the question about what brings them the most satisfaction, almost every single time, that's the answer. It's seeing the person that I'm able to help and make a difference.
That's right.
It's such a cool thing. So I'm not surprised to hear that. So when it comes to patients' understanding about living with or treating chronic pain, what's one thing you wish that they knew?
I'll say it like this. One thing that happens is sometimes they feel like there's no options, right? And so just like you said, you just learned how to say physiatry today, right? So a lot of times they just don't know that there's options out there, right? So if you feel like, hey, I've just been told by my primary care, this is all I got, just make sure that you look out there. Look, with social media these days, your successful show right here is one of, there's so many things out there you can just explore, and don't be afraid to look outside the box and see if there's something else that could help you.
Yeah. Now, if someone's dealing with ongoing pain, limited mobility, or recovering from an injury, what's the best next step?
Well, if it's chronic and it's been going on and you've kind of seen your, even if you've seen a chiropractor or maybe seen like a therapist, there's outpatient therapy where you can just go in to see people. You don't have to have a PT note out there these days, right? You have these freestanding. So if you feel like you've kind of gone down those paths, and you're somebody, a lot of times people say, I hate needles, or I don't want to come to doctors, right? They're just so averse to medical treatment. I think you can always ask friends, right? The greatest way to market is word of mouth, right? So you always ask neighbors and friends and family and coworkers, hey, I've got this issue, ask around, because then you often may find something out there that, like what we do, if you can't find something on social media, and don't be afraid to come just talk, right? Remember, when you come see a doctor in the clinic, we're not doing surgery that day, right? We're not doing blocks that day. We're just trying to evaluate you and give you some options of things that are out there. So don't be afraid to come just talk to a physician, a specialist, and just know what your options are.
Yeah. Okay. Well, you said it. I mean, just get someone to help you. And the great thing about Bone and Joint Institute of Tennessee is they have people that do everything. So you go there, you're going to get an answer. And the communication that's there between the physicians they're going to solve it for you. You go there, you're going to get your answers. So where can patients go to learn more about what you do, about you, or schedule an appointment with Bone and Joint?
So I'll be starting here in Spring Hill on July 1st. So if you're looking to see me down there, I'll be available July 1st in Spring Hill. The main headquarters is in Franklin, right? And they have walk-in clinics all around Williamson County. And so if you're looking, if you want to come see me, I think they may be starting my schedule pretty soon.
Yeah, I would bet.
About 2 months out. So 2 months from today.
Yeah.
Right?
Wow. Yep. That's exciting.
Yeah.
You can't miss Bone and Joint. And, I just want to express my gratitude as a parent of 2 high schoolers for all that Bone and Joint does, again, for Williamson County schools, the high schools, the athletic team. And we watched a lacrosse player, we thought broke his collarbone. He didn't, which was obviously good news. But my first thought was, thank you, Bone and Joint, for being here, because, I watched from a mom's perspective this happen. And it's like, having somebody there that is going to do the right thing and take care of you. And for everyone that's listening, Bone and Joint does this. They fund this exclusively. It's such an incredible service that they do for our community. So, and they're so knowledgeable. So go to Bone and Joint, follow them on all the social platforms. They're everywhere. But just search Bone and Joint. You can find all the specialists there. If you don't know who to call them, call Bone and Joint. They'll point you in the right direction. We are really excited to have you come join us here in Middle Tennessee.
I had a good time. Thank you very much.
And you're going to be right in the Spring Hill location. Right. And so if anything you heard tonight or today, whenever you're listening to this, we all know people that suffer from pain, chronic pain, that maybe just they think they have to deal with it. So this is your message of encouragement to don't let them deal with it. Have them reach out to the team at Bone and Joint. It may not be back pain. It could be something else, but they can help you with it. So reach out to Bone and Joint. Send this episode to someone who you think it might help. And Dr. Dockery, thank you so much for being here with me today.
Thank you for having me.
Thanks for being here. And listeners and viewers, thanks for tuning in to the Lyndsay Stafford Show. If you found value in today's episode, please like, share, comment, rate, review, and subscribe. We'll see you next time.